Have you come across this scene? Or are you the one in the picture? If you are, you could be suffering from OSA. Well, possibly. So, what's OSA? It's a sleep associated disorder of breathing with a reduction or a complete airflow obstruction despite the effort from the patient to breathe. As Broadbent defined, it's a potentially life-threatening condition in which periodic cessation of breathing occurs during sleep in the presence of inspiratory effort. The picture tells you that during sleep, the muscles relax, allowing the tongue and the other soft tissues to fall back on the throat, leading to obstruction of the airflow. And that is the pathophysiology of obstructive sleep apnea. If you have concentration or memory problems, disturbed sleep and excessive daytime sleepiness, morning headaches, snoring, gasping or choking while sleeping, frequent nighttime urination, and feelings of depression, you might be having symptoms of sleep apnea. Your doctor might ask you a few questions regarding your sleepiness, like if you're sleeping during a traffic stop or during a meeting, or he might give you this upward sleepiness case and ask you to fill it up to assess your sleepiness, how frequently you're sleeping or dozing. The other diagnostic tools that we use are polysomnography. This records patterns of sleeping and breathing together. It's usually performed overnight at a sleep center by the help of a technician. We have multiple sleep latency tests, which measures the time that you take to fall asleep. Usually done in a dark room, at least 4 different occasions in a day. Treatment of obstructive sleep apnea includes behavioral interventions for mild OSA, non-surgical options for mild to moderate OSA, and surgical options for severe OSA. So when we say behavioral intervention, many times we see that the patients are obese, morbidly obese too. And so they have to take up weight reduction therapy or follow a healthy lifestyle. They should stop smoking, alcohol, drugs usage, or even using a sleeping tablet, which might affect their routine sleep. We suggest positional therapy for patients. They should avoid sleeping on their backs, and the head of the bed should be raised to reduce symptoms. As you can see in the picture, there is a ball at the back of his t-shirt, and it'll alert every time the patient falls on his back. Oral appliance therapy includes orthodontic appliances like tongue retaining devices, mandibular advancement appliances. So these appliances keep the mandible and the tongue forward, clears the lower pharynx, and allows continuous breathing during sleep. As you can see in the picture, the mandibular advancement appliance clears the airway by keeping the mandible and the tongue forward. The other non-surgical interventions include continuous positive airway pressure. It's a treatment option for moderate to severe cases of OSA. It's a device with a mask that fits snugly over the nose of the patient and transmits a continuous flow of air and keeps the throat open throughout the night. Surgery includes uvulopalatopharyngoplasty, adenotonsillectomy, and tracheostomy, and other similar surgeries to remove the obstruction that is causing the OSA. And in the picture, you can see that there is a laser treatment that has been done to correct the uvula region. The other surgical techniques are bariatric surgery, that is weight reduction surgery, and nasal surgery if there is any obstruction like nasal polyp. Patients with untreated OSA may suffer from cardiac problems, stroke or high blood pressure, increased insulin resistance, increased traffic or workplace accidents, impotence, memory problems or inability to think correctly, and so on. So you need to lead a very healthy lifestyle